Good evening, friends. Welcome to our 42nd non-stop webinar series. And today's our speaker is Dr. Shobha Shah, a passionate homeopath. She is practicing last 33 years and she is content editor of NJH. She has shared over hundreds of cases and articles in NJH over 19 years. She is speaker in various national seminars and webinars, and her core interest is to treat deep pathological cases. So I welcome Dr. Shobha on the platform.
Thank you, Nirupama. Thank you very much. Yes, good evening, everybody. So good evening, everyone, and welcome to the 42nd NJH webinar. Yes, as Nirupama said, the NJH is consistently going ahead with each webinar, regularly. And it is really a great, selfless teachings that the NJH is doing for the homeopathy. The NJH is not restricted to any school of homeopathy, and we are open to all the schools of homeopathy. From wherever we can learn homeopathy, through any methods, we are open to learn homeopathy, right? So I welcome you all on behalf of NJH. First of all, I will like to pay my gratitude to all my teachers at NJH, at ICR, Predictive Homeopathy, and HHF. And my special gratitude to Dr. Vishpala ma'am, our editor of NJH. She has played a very big role in my growth. And it is only because of her and because of NJH that I am here today and I am able to share my learning. She has given me she has put a trust onto me and has given me opportunities time and again to share my learning. So, friends, today's our topic is rheumatic disorders. So, rheumatic disorders are the group of conditions that are inflammatory, autoimmune, and degenerative, affecting the joints, muscles, and bones. And they cause severe pain and restriction in the movements as one's immune system itself is attacking its own healthy bones and tissues, right? So there are some of the most common rheumatic diseases, which includes like rheumatoid arthritis, ankylosing spondylitis, fibromyalgia, gout, SLE, systemic lupus erythematosus, scleroderma, osteoarthritis, and few others. So we will not go into the detail of the clinical aspect of the rheumatic disorder, but what I would like to focus is that what we as a homeopath aim at, suppose if the patient who is suffering from the rheumatic disorder is coming to us, to homeopath, then as a homeopath, what is our role and what would we offer them? So I feel that, here, it is very important, first of all, to see that, to find out that at which stage of the disease the patient is, either he or she, but he is in which stage, whether it is the milder stage, whether it is moderate, or whether it is the severe stage of the arthritis, since how long the patient is suffering from this arthritis disease, and what are the associated diseases along with the arthritis. Many a times patients do have the many other diseases like, any other diseases like hypertension, diabetes, or any other diseases. So we must need to find it out. That will help us into the posology and in managing the case. Also, we need to understand what is the dominant and the fundamental miasm in every case. So this miasm also helps us to understand the reversibility of the disease, that till what extent we will be able to help them. So this we will come to know from the fundamental and the dominant miasm. that, okay, at present, what are the complaints? How much is the pain? How much is the inflammation? How much is the degeneration or the deformity? And whether patient has any family history. Fundamental miasm, we can find it out from the family history, whether do they have the family history of rheumatic disorders into their families. Because if they have family history, then the help to, meaning their recovery is little slower and it gets a little difficult. But if there is no fundamental miasm, then it gets easier for us to approach, meaning to help the patients, and the recovery of the patient is comparatively little better. Also, now, like, what we as a homeopathy can give in the cases of this rheumatic disorders. So first of all, our aim should be that we should stop the process of the inflammation and the autoimmune process, whatever is going on in the patient. And we should try to reverse the inflammation and reverse this autoimmune process. Whatever we can help, to whatever extent, we should try to see that, because we can help at the level of inflammation, but not at the level of already the deformities. If they have formed, then it is very difficult. Then as a homeopath, we should not even claim, and we should not tell the patients that no, we are going to help you and all your deformities also will get better. So there, because every pathy has its scope and limitations, so we also as a homeopath need to understand the scope and limitation of our pathy when we are trying to treat such diseases. So we can try and see to it that we can help the patients in improving their pain, stiffness in their movements, and in the functioning of their joints. So we can help them to stop the further destruction and the degeneration and the further erosive process from progressing further into the deformities. So wherever, at whatever stage they have come, we can try and see to it that with our homeopathic similimum, if we can help them, that this disease process is stopping at this level itself and is not further progressing into the degeneration or the destructive pathologies. Okay. Also, we should see that we are trying to, with our medicines, we should try to reverse the miasm. For example, if the patients are coming to us in the miasmatic phase, when they are into the syphilitic miasm, when there are already lot of degenerations and which is already started, so we should see to it that that stops there, and the patient should be helped so that their miasm is reversed, either from the, if they are into the frank syphilis, then they can go into the psychosyphilis. So that will help the patient in their overall health. Then we should also see that the patient's functioning is improving. The functioning of the joints and the muscle is improving, because that is what is something which is disturbing and harassing the patient the most, because their movements get restricted and the movements are very painful. So if we as a homeopath can help them at the level of the pain and the movement and the restriction and the stiffness of their joints and the joints and the bones, then it is really very good improvement that we can help to them. Also, with such kind of diseases, what happens is that the mental health and the quality of the life of every patient also gets disturbed. Because you see, nowadays we are seeing that the number of cases of this rheumatic disorders are increasing quite a lot, and even the autoimmune diseases are increasing quite a lot, and they really produce a lot of difficulty for the patient emotionally and mentally also, because they are quite restrictive and they are quite painful. So with that, what happens, and as we see as a homeopath, we have learned in our organon that there is a definite change in the patient's mental state also. They try to become irritable, they try to become like, their life is not peaceful, not at ease, they are not comfortable with themselves. And because of that, what happens is that their IPR relationship with the family, with themselves, gets affected. The disease, it also has its affection. Because of the disease, they cannot concentrate on their work. So the patients do suffer at all these levels. And with the homeopathy, if we can help them, to calm down into their mental health and to calm down in their disturbed mental state, whatever the vital force, because of the deviated vital force, whatever the disturbed mental state has developed, if we can help them, then it can give them better improved mental health, and the quality of a life will be better. So friends, I will be directly sharing with you two cases. The first case is of a chronic arthritis. The patient came to me on 12th January 2021. Here it is a case of a 33-year-old female patient. Now she came with her husband, and what had happened is that this patient was already taking a treatment from another homeopath at some charitable clinic. So she came and she complained. I think that doctor was moving somewhere out from that clinic. So that is why they heard from some patient about me. So they came to visit me. So the patient said that because of so and so reference, we have come here and we will like to continue with the things. These are my complaints. So I told her, okay. But she said, doctors, what are your fees? And I was taking treatment from the charitable clinic and I cannot afford this fees. So then it is only if you give me some concession or something, then I will continue here. So I told her it is okay, not an issue. So whatever you were paying at the charitable, you can pay over here, and but you continue with the treatment. Thus we started this thing, and then I gave her an appointment and she came for the case taking. So that time then she came and she complained that she again came with her husband, and she complained that she had severe joint pains in both her extremities, in the hands and legs, in the back, in the neck, and in the fingers, wrists. Her ESR was high. It was ESR was normal. It was 14. RA test was normal, but her NT-CCP was high, and it was 47.41. So the normal is up to 17. So when the RA test is normal, but the NT-CCP is high, it tells that NT-CCP is a marker of rheumatoid arthritis. So it tells us that either the disease is in the very initial stage of or either patient will develop this disease in a immediate future. So, so she complained about lot of severe leg pains. The pains were there in all the joints. So what she said is, doctor, I can't stand for a longer time because I start getting the leg pains. My fingers are also paining in the winter if I work in the water, and I get a neck pain if I bend down and work. So she's coming from a lower middle class family, and what she used to do is initially before a few months she used to bring some imitation work, and in some imitation bangles and all, in which she was putting the diamonds. So she used to bring that to work at her home. But what started happening is that she started getting the neck pain and all, and then she had to stop that work. Then she also described her pain that I'm getting the pain as if my bones will break. The pain is so severe. And while getting up from the bed also, she said, if I rest my hands on the bed and try to get up, I feel that my wrist bones also will break. And I need to be very careful while getting down. While getting down also, I cannot get down speedily. I cannot get up also because of the pains. I cannot, meaning finding it difficult even to get down also. And she feels that even while sleeping also in one position at night, she starts getting pain of that side of the body. That much is the pain of the patient. Now friends, here I am also meaning telling about what is my understanding coming up, how is my thinking process, and how am I analyzing this case. That also I am trying to tell you along with describing the case. So I felt that, here the patient was feeling really being persecuted because of the pain. So she said, because whenever she has pain, she said, if I have this, and if my son asks me something, then I get very angry on him. And I tell him that you don't ask me anything. You go out and you play. I feel that if चुपचाप मुझे शांति से बैठने दे, but you don't ask me anything. I feel better if I go out and sit in open in a garden. And I feel that my life is useless. I'm living in vain. And it would be better if I would die. And she would also weep with the pain. So there is a weeping with the pain. There is a anger and irritability with the pain. Even later on in the case taking, the husband also said that she gets very irritated during her pains. So then I tried to take these rubrics like, that anger and irritability, pain from weeping with the pain, spoken to being aversion to, she did not like, and open air ameliorates. Then she also said that because of the pains, doctor, I can't make the laddus for my children. If there is a festival and if I feel like making something for my son, I cannot make those laddus. I cannot help my husband in any work. Like, she said, as a wife, you feel like helping your husband in and so that he can be helped financially also. But doctor, because of my pain, I cannot help him. So she was not liking that also. And she said, I can't lift weights, I can't lift vegetables, I can't lift milk, I cannot go to market. And whatever for others, the weight, whatever is normal, but I feel that it is too much weight for me. And that is how it gets, for her, it is very difficult to go to even markets. So at that time, what happens is her elder son is helping her. She has two sons. One is 17-year-old and the second son is 9-year-old. So her elder son helps her very much. And she said कि भगवान ने ऐसा लड़का, ऐसा son सबको देना चाहिए. She was very happy with her son. And she says that he makes roti, he cuts vegetables, he fills water, he washes utensils, he helps me in all this work. I am just not able to do all this. But my son also tells me that, mother, you go out and you go to the auntie's house and you go and you be there for some time, you go and visit her and you will feel fresh. And there is also one niece, her sister's daughter, she has also come to live with them, and she also helps her into all the household work. So patient is able to do very minimum and she does hardly any work at home. So because at home, like if I'm sitting, I keep thinking and I forget. If I go out, then like मैं वो बाजू मतलब वो आंटी है बाजू में, उनके साथ बात वगैरह करती हूँ तो मैं मेरा भूल जाती हूँ पेन. But if I'm at home, so then even the son and the family members have understood this. So they tell her, okay, you go out for some time, so that you will feel better. But patient says, but doctor, for how long? Like, will I take someone's support? The life will be miserable if I don't get better with the medicines. And I will become boj on even others. So this is what I felt like, that she's forming the theories and she's giving that explanation. And I felt that this is a theorizing. Then I inquired her about her complaints, that when your complaints have started. Her complaints have started in 2000, since 2014, when her age was only 26. So it is like at a very early age, she started getting these difficulties. So I like, what we have understood and learned is if the pathology is deep, then the stress is also what the patients pass through has to be very deep. Then only it creates a deeper pathology. So then I asked her, okay, what was your stress at that time? What had happened in 2014? So she said that her brother had met with an accident and he died with the accident. So she said she was very much attached to the brother, and both of them like were gelling very, very well. So she felt that, as if everything of mine is over. He was everything for me. He was taking lot of care of me. And if in trouble, he would talk to me. मेरे सुख दुख में मेरा साथ देते थे. And I was shocked. I felt as if, I also should not be alive. We lived like friends. He loved me very much. We were very much attached to each other. We grew together in the difficult poverty time. My father was not there, mother was there. And when this happened, I was very much in pain and very much in pain. So in her childhood, they had faced a lot of poverty. So she was staying in the village in the native place, but then there was a lot of poverty. But in that time also, there was a lot of attachment and good bonding between this patient and her brother and all the siblings. So patient was in the shock, and her son was also very small at that time. Her second son was just about a year old or so. So patient said he was very small, but still I couldn't pay attention to him, and she stayed in a shock for a very long period. So she used to go into the frequent spells of fainting, and the relatives had to sprinkle the water on her face and then bring her on in the senses. And patient, she was not eating, drinking much, no, not paying attention to that, and not be able to pay attention to her son also, because she was so much into that shock. So when she was saying this, that time the husband also added that, doctor, she still faints if she takes any extra stress, or she overthinks, or if anyone scolds her, or if tells her anything, then she still faints. So these are the rubrics which I took for her, like, elements from mental shock, grief, the death of loved ones, parents or of a friend, and hysteria and hysterical fainting. So patient likes more at the neighbor. Another thing, patient told is that she does not like much in Mumbai. Now she's living in Mumbai. Earlier in her childhood, she was in the native place, and she was very happy at the native place. But here in the Mumbai, she is not that happy. So she remembers her native place very much. And she said that at native place, we were poor. We were not very, this thing, good financially, but still our bonding between our the whole family was very good, and so she liked it very much over there. Also she said that, the greeneries and the plants that she liked over there. Then she said, here, I just asked her that here also you can buy but she said, here if I have to, then I have to buy those plants, whereas in the native it is not so. So another reason, when I asked her after some time, again she repeated a similar thing that she liked more at native place. So I asked her again that, was there any other reason? So that time she said the life in the village was very simple, and we all had a very simple life and simple food, and मतलब बहुत ही एकदम सादा खाना बनता था, सब सादा रहता था. Like my father wasn't fussy, and because of poverty also, like we used to cook very simple food. But here the husband and the in-laws are financially okay, and they were okay since quite some time. So that is why they used to, eat paneer, etc. Whereas we never ate. We hardly ate the rice and the kurmuras and all, like. So patient said, I haven't eaten all this in the childhood, so how can I cook? And the husband is like, little unhappy and angry on her that she doesn't cook properly. So patient also feels bad that she doesn't know how to cook all those. And she said that husband should have asked me before marriage whether you know cooking or not. And because I had seen my father, that he used to eat whatever my mother used to give. He never used to make any fuss. Whereas she also said, doctor, I don't think that today any husband, I will say that, okay, you don't cook, or, you don't take trouble, and we will eat whatever you cook once, we will eat it on both the times also. And the husband is sitting next to her, and the patient is telling this, and I was like wondering that what is the patient saying. Friends, I want you all to understand this incident of the patient, and just think about that, what is she saying and what are its implications. We will come back to it when I finish with the case. We will talk about and take your views for a little bit. So patient also said that her brother-in-law is living in the Mumbai, but they all are living independently. There is no much relations between them. and the patient feels bad that there is no much mixing and they are not even looking after or caring for each other, and there is no much apnapan that she feels, so she feels that she's the person who likes to be in the company and feels better. And the patient had some dispute with her elder brother, with her one, but still she is telling her son that you don't spoil your relation with the uncle, and you do listen and obey to him, and if anything happens, like, you help him. So I was surprised. I asked her, Ki, why? I mean, when your brother did not to behave good with you, why are you teaching your son to behave good with him? So she said, no, doctor, I don't want my family to end, and I want that, how will be the life without family? So it is better that my children also are in connection with the family. So I felt that she was sensitive to the morals. And then I asked husband that, can you tell me something about her nature? Does she get angry? So husband said that, yeah, she is irritable whenever there are pains. Otherwise, she's fine. So patient immediately intervened. Then she said, Ki, now I have started getting angry. Earlier I wasn't. Now I have learned that I won't be able to live if I don't get angry. So if I don't quarrel, and the society is also of this type, so that is why I have to get angry. And then husband did not say anything much. Yes, friends, any inputs from your side?
As of now, nothing is there.
Yeah,
So
but
please write in chat.
can they like, if anybody wants to say anything now, especially about that incidents that I described?
Shobha, previous slide person wants to see.
Sorry, previous slide.
Previous slide. Huh.
But I am asking about this incidents. Whether
Yes.
anyone wants to have their these things, uh, they can write in chat or they can express it.
She has become fearless. One input.
Okay. Yes, because she tells husband now. She has understood, she has learned few things of the realities of life. Okay.
This
Anything
could
about
be taken out of timidity.
I have not given my understanding the way I kept on giving you my understanding about the case, my analysis. I'm not giving it this incidents. If
Loves
anything,
nature.
hmm.
This could be critical out of timidity.
Okay. But okay.
Indifferent to surrounding.
Okay.
Now she got changed. She became indifferent now.
She has not become indifferent, but she has interest. But like, she has become little irritable. Earlier, like, she used to be fine, but now because of her illness also, and because she is thinking that earlier what used to happen is that if the husband used to scold and if I used to just listen, then like, husband used to keep on scolding. That is what is her understanding. So now she says that now that is why I immediately get angry and meaning reply back, so that now then her husband doesn't talk much later on, he keeps quiet.
Imbecility in adherence with Ignatia.
Oh, okay. Okay. So yeah, friends, I will tell you here that
Complaining sepia.
okay. So the friends here, first prescription of mine was Ignatia. Yes, the way you all said, meaning whosoever has felt that, because of her ailments from that, shock, mental shock, the death of her brother in an accident, which was a very sudden, and her reaction to it, like, then I also felt that she's an Ignatia, and I had given her Ignatia. I gave her Ignatia for 3 weeks, but there was no improvement at all. And then I had to go back to my video again and then understand whatever information I had. So Nirupama, I would go ahead. Okay. So,
Yes.
so one more thing is, yeah, okay, about her, this, uh, about my observation about how she looked, she looked very beautiful, and she was little fair, little obese, and she was very fair lady. And what had happened was, like, she had come with a dress which was a greenish dress. Along with that, she had painted her nails also greenish, and she was having big bangles, with all that stones and all, and hanging earrings, and a sindoor, and along with that there was a crystal ka mala, but which was again matching with her dress. So which was something very, this thing, the way she was complaining of all the pains and all this, like, I felt that this attribute of her being this look, from her look, that she was coquettish. uh, what is coquettish is, like, the I have seen this repeatedly in my clinic, that, whenever the patient, especially the females, when they come up, dressed up, usually in the clinic, when they are coming for their treatment, when they are in the pain, when they are not well, and that is the time you do not expect this. If they are going for some function, for some events, or for some wedding, and then they get ready so much and then they go, it is quite good, but normal. But here, when they come this way, I feel that it is a little abnormal thing, and which we should not miss, and we must give importance to this observation. And that is how I took that as a coquettish. Also, her way of saying was very childish. Her describing the case, which, like, I gave importance in my second analysis. And initially what she told me and what she asked for the concession, that was, again, I felt was her bargaining. So friends, when I analyzed and repertorized all these rubrics, see, the remedy which was coming up was pulsatilla. And if we understand her incidents, what she talked about, the about her cooking, and about her liking the village, the native place. When husband was sitting next to her, see what is happening. What is she saying? From the childhood, her family was very into a poverty, so they did not eat much fancy food or anything. So she was also, she had learned a simple cooking, and she was into that simple cooking. So that is fine enough. But now her elder son is 17-year-old. So she is married since quite some time, and she knows that at the husband's place they were quite okay financially. He used to eat, he likes eating all those things. So she has to learn somewhere, and she has to make that for the husband. But what the way she said is कि हमारे घर पे तो father was very not fussy at all. He was very fine, and he used to eat whatever my mother used to make. And in today's time, I have not seen any husband who will say that nahi nahi tum taklif kyun lete ho, you just cook only once and we will eat both the times. Like, and that is all what she was saying when the husband is sitting next to her. So I felt that this is the manipulation of the pulsatilla. That she wanted to manipulate the things and tell it in a way that she likes native, and she is trying to, convey it to the husband in that way. So that is what I felt, and I prescribed her pulsatilla after that. These are all the rubrics that whatever I have told you in my analysis, I have analyzed that, and what came was pulsatilla is the one which is covering it through and through. Okay, one more thing which I would like to say is, in ailments from death of loved ones, earlier I had taken ailments from death of loved ones and I got stuck at ignatia, because in that rubric pulsatilla is not there. But then when in this case it was there, coming up very much. So then I tried to see any other rubrics which are there, which are related to the death of loved ones, in which we can find is pulsatilla there. And then pulsatilla is there in the rubric like ailments from death of loved ones, of parent or of friends. And here the patient was considering her brother as her friend. Her relationship was very friendly about with her brother, and that was of a friend. So I gave her pulsatilla. Initially, I started with the ignatia for 3 weeks, no relief. Then I gave her Pulsatilla 200, 3 doses stat at 10 minutes interval, and followed by SL. And then Pulsatilla 200, 1 dose weekly, and then 200, 3 doses weekly, then daily HS, then 1 dose, and then 3 doses weekly was given. So patient felt very much better over a period. This is a follow-up of over a period of 2 years, and patient felt really much better in all her complaints, in all her joint pains. Her dependency on the others also reduced, and like she started doing her own things, on work. That was also like very much something striking for me, in the case like that she was not doing her part of work, and her son and her niece were doing completely. If it was Ignatia is like, who is too much into the responsibility and who is into the mildness, bearing the complaints, and she would bear with the complaints and still she would go ahead with doing her work to a great extent. Whereas what this patient used to do is she used to put everything on the son and the niece, and she would go and sit outside. Definitely she was into the pain, she was finding it difficult, there is no doubt about it. But still, if it was Ignatia would have still gone ahead and done the things out of her responsibility. Whereas this patient, she used to leave and she used to go out and sit sit out, and leave it on to the son and the niece. And that is why I felt that this was somewhere a selfishness of this patient. So, but later on, she started doing everything. She started cooking, going to the market, she's bringing the vegetables and whatever she had to do with a minimum and the no pain. And she did not need any help of the son and the niece. Her stiffness of the joints reduced, irritability also reduced, and like, she started cooking also happily without grumbling or without complaining. Then she also had interest in develop some beauty parlor things, so she started doing that also, in some part-time, for some part-time. So friends, it is happening. I am telling you my experience also. Like, it has happened many a times that I have missed Pulsatilla. Pulsatilla we have learned in our initial years of college, and it is a very commonly prescribed remedy. We prescribe very commonly, but still we do miss it also many a times. And that is just and just because of the what is said, because the Pulsatilla is manipulated, because the Pulsatilla needs love, and the way the Pulsatilla projects her own self, that is why we come into that, the way she says, तो हम like उसके दुख के साथ हम दुखी हो जाते हैं. And many a times it happens that when the Pulsatilla is describing her story, there are tears even in our eyes, and we are moved even with her pain, and we missed out the Pulsatilla. So that is why, meaning this is what is a big catch, and we need to understand this. And if we can catch it, we can crack Pulsatilla. So if we understand in the Materia Medica also, in the keynotes, what the first sentence what is given is, there is a forsaken feeling often expressed in the need for attention. It is only in the need of attention. They need a lot of attention, and when the attention is not paid, they go into that forsaken feeling. They do anything to fulfill their need. That is because of their selfishness, selfish nature. We all know that Pulsatilla is better by consolation, ameliorates. Pulsatilla is a yielding and a very adaptive lady. Otherwise, she being from the plant kingdom, even in this case also we saw that what was we getting was the sensitivity and the reactivity. There was no other issue of any like me versus you of the animal kingdom, or there was no other issue of structure. So the animal and the mineral kingdom was ruled out. But the sensitivity and the reactivity was coming up very clearly, and that is how the plant kingdom remedy will come up. Pulsatilla is very emotional, sympathetic, and weeps easily, often very mild and can be irritable. With changeable mood, timidity, blushes easily, jealous, irritability before menses, fears. Okay, so friends, I would just like to share some of the points which, like, we of the Pulsatilla, which are very, very characteristic. And if we understand this, we can crack the Pulsatilla in a ease in a better way. So pulsatilla is definitely, as we know, that it is a feminine remedy, and we prescribe most of the cases into the women, and in very, very few cases into the men. But in those men who are like, who have that feminine traits, who are effeminate, there we can think about pulsatilla. But otherwise, they are like 99% it is a female remedy. And those females who are very girlish, who are childish, who are very delicate, and who are like who are handle me with care, that type of women, that you cannot scold them, you cannot tell them anything loudly, otherwise there will be tears immediately into their eyes. And pulsatilla is a single remedy in carried and caressed desires to be slowly. Now, what is the slowly? Meaning you cannot handle them roughly. And when these patients come to our clinic, like, they are the ones who will tell you that, doctor, don't give me any strong dose. Like just 2 days ago, I had one pulsatilla patient, and she said that she had been to her native place before 2 weeks. There she suffered a fever, and she took some allopathy treatment she needed to take it because she did not have any other option. And when she came here after 2 weeks, she is still telling me कि डॉक्टर उन्होंने मुझे इतना भारी दवाई दे दिया था कि मुझे अभी तक वो दवाई मतलब की तकलीफ हो रही है. Still I have stomatitis and I'm not comfortable. So that is how, that much is the pulsatilla soft and delicate, and they do not want themselves to be handled roughly or harshly. And against this pulsatilla to be handled slowly, we also have another one single remedy rubric, which is carried desire to be with a soothing, and entim crude is the only remedy. So if we differentiate these two, in entim crude it is a very lovesick remedy. So they want to be soothed meaning they want to be calmed, they want to be soothed very politely, like very softly, but with a love. Whereas in pulsatilla, you handle her very softly, gently, and slowly. That is what is the difference in pulsatilla and the entim crude. Then pulsatilla goes with the wind, and wherever there is a love, it will bend towards that. Pulsatilla is a bottomless pit. आप कितना भी करो उसके लिए, उसको कम ही पड़ेगा. वो यूजरर है, एंड यूजरर की तरह शी इज लाइक की तरह वो उसे यूज करते जाएंगे, आपको यूज करते जाएंगे. So pulsatilla is there in the rubric of usurer and selfish also. Pulsatilla can manipulate situations and attract affections of her relatives towards her, and that is why you will see pulsatilla is also dependent. So because of that, and because of her quality of attracting affections, you will see that in 99% of the cases, pulsatilla lady will not come to your clinic alone, and she will always be accompanied by the husband or the relatives. Like that is what is my experience in most of the cases. Then pulsatilla bargains through her manipulation, the way we saw in my today's case also. And pulsatilla is selfish, avarice, and wants all for herself. Pulsatilla will manipulate and feign it sick, but with love. To you, it is very difficult to understand her feigning also many a times, because she does it very much with love. And she will be attended and pampered by her relatives because she manipulated them with her sweetness. Pulsatilla is also there in the bed desire to remain in. And what is bed? So it is the comfort. So she wants to be into the comfort. Wherever she gets comfort, whether into the IPRs, she will, in whichever IPR, from whosoever she gets that comfort level, she will be comfortable with that person. So thus, if we can find that, any person, any lady who is mild, affectionate, coquettish, yielding, and manipulative, then we should think about pulsatilla. About coquettish, one more thing I would like to say is, once, like, there is one patient of mine who came to me, like, she took an appointment in the emergency. Like when I told her that there are no appointments today, you please come next day. But she was not ready. She wanted to come immediately on the same day itself. So she said that much, she said she has a pain, and that is how she came. But when she came, like, she had done all the eyeliner and the hanging earrings and a makeup and a lipstick and everything. And I was so surprised. I thought, oh, she was in a bad pain and that is why she wants to come. And still, I felt that, I mean, this was something very much. So that coquettishness of her was very coming out outstandingly. So another one or two examples which I would like to give is in small children, like, if you see that they also want to, many a time mother also tells that, that their daughters who are there, they love the matching clips, they love the matching purse, they come with all those things, the small baby children also in the clinic, and mother tells that they love all these things. So there also you can apply this rubric coquettish. There are few other remedies also. You can take which the remedy fits, seeing everything, all other things in the case. But you can apply coquettish there. Another example which I came across was, there was one lady who came, she was around in her 70s, and she was widow since about a year or so. But still, when she came to take medicine, she was coming from a good rich family, but still when she came, like, she was wearing all her gold earrings, she was wearing all her mangal sutra, bindi, and gold big chain and everything. At the same time, along with that, she had also worn a sari with a blouse which was embroidered, like, which was embroidered from the designers. That type of blouse she was still wearing. She said she likes all these things and she continued it. But we should keep in mind that she was 71-year-old, she was widow since 1 year, and still she continued. So that much is the attraction, that much is the obsession, that they like it so much. And in such cases, you should definitely take up the rubrics like coquettish. These type of rubrics which have very small number of remedies in that helps you a lot to reach the minimum to a very fast. Okay, friends. So with this, we will go to the second case. Now, the second case is of a 27-year-old male patient. And this male patient, he's a CA by profession. He was brought by his fiancée. And here, this patient had already come to me 2 times earlier. Like, once he came for the piles, and once he came for the allergic rhinitis. So both the times his presentation was somewhat similar. And so you please focus on to the presentation. Now, in this case, I'm not giving my analysis the way I had given you earlier. And let us go ahead with you. You try to understand how things are going, and I would like to know your analysis at the end of it. So you focus on the presentation. And here, what happened is that patient came and said that, he's having a lot of chest pain with upper cervical and a dorsal back pain, the pain in the hands, legs, and the fingers. And he's CA and working in a firm, but he's a highly anxious and fearful about his health. So with the chest pain, he got scared that, doctor, is it a heart pain? And doctor, if I had a chest pain and it was extreme, it was intolerable. So I went to doctor, BP was 140/80. Doctor did ECG and he gave medicine also. I had lots of pain, lots meaning lots. It was extreme, doctor. And all my family members came. It was at night time. He was describing this pain which was there, and all my family members came and they pressed my hands and legs. My mother and father and my grandmother came and she pressed and massaged my head, and I was having extreme pain. Even after taking the tablets, it was not better. And my body is very heavy and legs and fingers are paining a lot. I feel as if, I should cut it off and I should keep it aside. And the hands are paining very much. And he used to press his hands even during the sleep. And the way he described it was that the pains are, I felt as if, कि जिस्म में से मेरी जान निकल रही है. And मैं पागल हो रहा हूँ ये pain से. That much is the pain. And he has anxiety and he was suffering. This anxiety and his suffering of this pain was seen on his face and in the way he was describing it. So he also said that he feared taking the COVID vaccine also. This was the case in the 2000, again around 2021. So he was fearing taking that COVID vaccine because he felt that if I take a vaccine, my hand is already paining, and if I take a vaccine, it will still pain more. So then with that, he had gone to his family doctor, some GP, and then they got the blood tests done, and his RA had come positive. His rheumatoid factor is 57.3. So he immediately visited the rheumatologist, and he gave him some medicine for 10 days, and but still the pains were severe. So and he was quite irritable and restless with the pain, and then he decided to come to homeopathy. So he said, "Ki doctor, since last 3 years I'm getting this pain, and I get this chest pain. But whenever I go and to the cardiologist. Every year I do the ECG and X-ray and all to be on a safer side, but everything is coming normal." And so I asked him, "Why so much of tense? Meaning, are you tensed on about the chest pain? Why so much tension? Any stress is there?" So he said he has taken some home loan of about 40-50 lakhs because he was going to get married, and he had to decided to buy the new house, and for that he has taken a loan. And in his childhood also, like it was a very struggling, and coming from a lower financial family, and a lot of struggles were there. But it was after slowly he started studying well, and he went on clearing the exams, and he became CA, and then he started slowly getting the good job. So after that, then now he's going to get married. So he decided that. But he is under the tremendous pressure that, "Doctor, my health is not keeping well. And if anything happens to me, my wife is not capable of, repaying this loan. If I take 40-50 lakh loan, and if anything happens, what will happen to my family?" So that is what is something which is troubling him. Also recently he has seen that one of his friend who just passed the CA, and within 1 year he met with a sudden heart attack, and he passed away. Also there was another aunt of his, she also suffered sudden heart failure, and he was very much attached to his aunt, and he had just met her the previous day. So that aunt was there on his mind, and he was not able to forget her and forget this other CA friend also. That was disturbing him quite a lot, and that was affecting his health, affecting his sleep. And so because of that, what used to happen is that if his father or mother were not at home, and if he's alone, he would not be able to sleep. So then next day what he did is he told his uncle that, "You come home and you sleep here, because otherwise I'm finding it very difficult and finding it very fearful." So other than that, work wise, he said the stress was like as what it was in the COVID times for everybody. He said that there were no, during the lockdown, there were no clients who visited our office, and when there is no return, like what to audit, and we can't even ask for the money from anyone. But he himself again said that, "Doctor, but this is temporary. This work tension is temporary. If there is no much work, but I'm very sure that this will be okay. But I am more stressed about my health." That was coming up in his say. "And it is because of my hands and the pains that, doctor, whatever small work also I have in my hand, I am not able to do." That was his concern. "And I feel very much inefficient and not energetic, that I am not able to do even this little work." And his sleep was also disturbed because of the pain. Also, at times, like he used to feel congestion in the chest. He used to get the chronic cold complaints, and he used to get it with cold water and the cold drinks. And he said, "I have cold since last 10 years, and whenever I get it, I go to doctor immediately and take the medicines." And because at that time when I was studying the CA, I didn't want to get disturbed in the study, so I used to go immediately. Now it is okay. And he, along with all these complaints, his concomitants are gas, acidity, and the burps that he gets usually with the as a concomitant with these complaints. Also, he had toothache complaints, and he visited two dentists for that. And in the past, he had, the way I said, allergic rhinitis and the piles. And when he had piles also, he had visited a surgeon, but he was not better. Again, he came to homeopathy. And allergic rhinitis also, he keeps on visiting his family doctor or some other doctors or physicians, And when he came, yes, he was also dressed very much properly, and he was looking like a very good looking and a handsome patient. So this was my observation. Yes, friends. Anybody will like to say anything?
With this case, there are no questions, but there are a lot of questions regarding previous case
So we'll take it up at the end.
at the Indies.
But in this case, anybody has to say anything about how is he saying, what is his presentation? He does not have any other problems. In this case also, there are no other complaints with any of the IPRs, his relations with, he has one sister and father and mother. The relations with them are fine. His focus is on his work, and he's doing good in his work, also doing the job, but he is fine in it. So there are no other issues other than
Anxiety health about
yes.
anxiety for health arsenic album.
Okay. Yes.
Aconite.
Yes. Very good. Very good. Very good. What else?
Anxiety with restlessness, fear of heart diseases.
Yes.
Then one contribution is lycopodium.
Very good. In his case, this case also, I had given him lycopodium to when I did his this case history completely. But what happened is that he was not better with lycopodium, and once like he came with the pains, and whatever I have described you in the initial, this presentation of his, this is what he came with. And that time, when I saw him with that complaining, earlier he had just described his case. But when he actually told all the things, and I was feeling it like, the way he was describing, the way he was presenting, I felt that, with whatever, the pains were definitely severe, but the way he was describing, I really felt that it was too much and little out of proportion, the way he was talking about his pains and his complaints, that presentation, that he was really troubled by whatever was going on. Otherwise, if you see, he has visited so many doctors. He has visited 2 dentists. He used to, if thoda bhi hua, to he would go to the surgeon, go to the cardiologist, gets a chest pain. All his reports are coming normal. Since 3 years, he goes to cardiologists every year. He goes and वहाँ पे मतलब they get his X-ray and ECG done. So meaning that much is the anxiety level. See, just try to focus what I am trying to convey to you. That much is the level of the anxiety, that he is visiting from one doctor to another, and whatever small thing happens, he gets so much panicky and so much anxious about the things. So this is something, friends, we need to focus on to. Here also, like in this case, if we see, there are no other issues of like me versus you or any other animal qualities we are not getting. So the animal kingdom is ruled out. Even there are no other issues related to the structure or organizations or any other things. So again, the mineral kingdom is also ruled out. But what is coming up is his sensitivity and his reactivity. And again, which is again pointing towards a plant remedy and the plant kingdom. So, yeah, Nirupam, I'll go ahead. Otherwise, time will fall short.
There is exaggeration, panic,
Exactly.
Calcera
Yes.
Ars, Kali Ars, Kali Kal.
Exactly. Fantastic. Yes, this is what is the exaggeration and the panic that we need to see in this patient. Very good. I want you all to see this only. Very good. Okay, so I will just go ahead with what my understanding of analysis is and how I went ahead. So, friends, the sum of the rubrics that I felt was, it was the fear of death, कि कहीं मुझे भी तो heart attack नहीं आ रहा है. What is this chest pain about? Whereas it was most of the time, it was the gas acidity and he used to have those burps. and he used to get that. But and all his reports, blood pressure, everything was normal, but still he had that fear of death with that chest pain, and he would run to the cardiologist. So he had that anxiety driving him from place to place, the fear driving him from place to place. But more than everything, the way he was presenting, that is what I said. When he came, even for the piles, when he came for the allergic rhinitis, and now also when he's coming for his rheumatic pains, his presentation is too much of exaggeration, too much of something, which I felt which was out of proportion, which he's just not able to bear. He is an adult male, and when he gets the pain, he meaning pura ghar ko ikattha kar leta hai. His father and mother and everybody is coming and sitting and trying to help him out. Okay, kaise usko help kar sakte hain. The grandmother is coming and massaging and pressing his head. This is what was his torment. And he was literally into that torment field, that he was tormented with his pains, and he was persecuted. But more than persecuted, he was tormented. He was troubled, but he was more. So when you have this much of intensity, friends, it is the torment. There are only two remedies in the delusion tormented he is. Because see, when you get the rubrics with lesser remedies, then you are more nearer to similimum. So if you can catch this, you should definitely try and see that in your clinic. You should try to catch that. Other rubrics which I took was fear of being injured. If I take a cold drink, if I take a cold water, I will get cold. That is what he felt. Then, and the horrible things and sad stories affect him profoundly. When he heard about that CA friend of his, when he heard about the incidents of his aunt, it was not going from his mind, and it was really affecting him very badly. Delusion hindered he felt that, because of his pains, he is not able to do even the smallest of the work, or the little work which is there. Because of the lockdown, there is not too much of work, but whatever little work he is not able to do. And it is just because of the pains, his work is getting hindered. And there is a disturbed aversion to being. He felt that, during my exam times, I did not want to get disturbed, and that is why I would immediately go to the doctor, and I would immediately take the medicine, even if I have smallest and little of cold also. Anxiety driving him out of from place to place. And friends, here the way we took cockatish for the pulsatilla, I took foppish in this patient. I will share my experience with you all about the foppish also. Like, this is the rubric which is foppish means it is usually applied in the males. The way cockatish is usually applied in females, foppish is usually applied in males. Then it is concerned with one's clothes and appearance in an affected and excessive way, which is typically for men. So I have seen this many a times recently. This remedy, I was recently that I have started understanding it more and more into the depth. I've been able to prescribe it into a lot of cases with fantastic results, and in different type of pathologies also. So if the males who come to you, who are properly dressed, who come with a istri tight clothes, or who are wearing some things. One male patient of mine, where I applied this foppish, he came with all the gold earrings, the rudraksh mala, gold chain, the bracelet, and his specs which were there, which were of a golden frame, and some bracelet in his hand. Where I could see that he was wearing more ornaments than what his wife was wearing. And he said, I love it. मुझे बहुत शौक है उसका. So that is where I applied foppish. Even in some other patients where they were not so much decked up, but still, if they have, they come with some rings, some chains, or they have that shock. They are shocking type of males who are there. There you can apply the foppish. One of my patient where I had applied foppish, in his case, his wife came and she told me that they had a small child. So what wife said that, doctor, whenever if we have to go for any wedding, and if my Husband is once ready, he will not carry my daughter. I have to lift my daughter. He will not lift my daughter because उसके शर्ट की इस्त्री खराब हो जाएगी. अगर when we are returning from the wedding, वो टाइम पे वो उसको ले लेगा बेटी को. That time he will lift. He doesn't have any problem in lifting the baby, but it is just because of the iron of the shirt should not get creased. That is why he would not lift. So this how characteristic it is. How commonly we see this. So there also I had applied foppish. So these are the things where we should not miss out onto the foppish rubric, because again it is a rubric which you prescribe, which you take it up on the observation, on the basis of your observation. And for our homeopaths, the observation is very, very important, and we must include it in our totality. And there are very, very limited remedies in that rubric also. So friends, when I repertorized all this, the remedy that came up was China officinalis, which is from a Rubiaceae family. So first I'll give you the follow-up, and then we go ahead with the understanding of China, and little bit more I'll share my experiences so that you can also prescribe it more frequently into your practice. So China, I gave him into the 30-201 m, was given in the infrequent and the frequent dosages. So whenever he would come with those severity of the pains, that is the time I had given her the same potency of China, whatever I am giving into the frequent doses, in the sense into the TDS doses also I have given for that 3 days or 1 week's time, whatever it was needed. And after that, again go back to the infrequent dosages. Because in his life, what was happening was he was just settling down. So there were some stressful situations in the circumstances, and whenever there are stressful situations in the circumstances, it tends to aggravate your illnesses. So this is what we are seeing in general also in most of the chronic and deeper illnesses. So that time you need to repeat little more, and you need to be managing the patient more efficiently at that time. We should see if there are any other indications coming up. We can go for any other indicated acute remedies also. But in this patient, what was coming up was the same remedy, the same indication. So I used to just repeat that TDS and give him at that time for that much period of time. And he got a very good improvement. His frequency and the intensity of the pains reduced to a great extent, and he started getting the peaceful sleep, which earlier his sleep was getting disturbed because of the pains he started. So then later on, he used to tell me, "Ki, doctor, give me those powders with which I'm getting a very good sleep." And his anxiety and the fear also reduced very much. Then he did not require to visit to too many doctors, which he used to go earlier, visiting from one doctor to another, which he did not require much. So, okay, we will go to the China. The mind we will do from the other this thing. Okay, one more thing is about some characteristics in the generalities of the China, which we must keep into the mind. Yes, as we all know, friends, that China is the first remedy which was proved by the Hahnemann. And because of China, there is a homeopathy. And because of that, we all are here. So we are really grateful to the China. So, which it affects blood. It has a lot of affinity for the blood and the circulations. There are anti-hemorrhages, anemia. Lot of cases are seen with this. And that is why I have also seen in my practice a lot of cases, patients of China come up with the complaint of piles, hemorrhoids, where even in this patient also he came up at one particular time with the complaint of piles and hemorrhoids. I am not saying that piles or hemorrhoids is equal to China, but do keep China in your mind. When try to see about the other indications, and when everything matches, do think about China and you can prescribe China. Another thing which is very characteristic of China in general is the debility and the weakness, which is again due to the profuse exhausting discharges and ailments from loss of vital fluids, which is very, very important in China. The intermittent and the periodicity of the China, with it also has affinity for the neuralgic pains. And patients who become weak, they become oversensitive and nervous to all the external stimuli like light, noise, odor, pain, etc. There are bursting pains because of the neuralgia. Good remedy for rheumatism and sepsis, also for the inflammation of bleeding organs after hemorrhages. Good remedy for convulsions, cancer cases. Post-operative, very good affections into the for the GIT also, and that is why in this patient also we got lot of concomitants of gas, burp, and acidity. So post-operative also gas, it is there, or otherwise also if patients of the China they have this the gas and the GI complaints, then also you can think about the China. So friends, see what is China. What I have understood is that there is a lot of torment. There is only delusion tormented is there are only two remedies, China and lycinum. Now lycinum is an animal remedy. We know it is prepared from the rabid dog, and in that you can see the different level of anger which is seen in the lycinum. At the same time, you see all the animal qualities which is seen in the lycinum. So it is easy to differentiate the China and lycinum when the torment comes. That is what I'm trying to say. So delusion tormented, whenever you see this torment of the patient, you should surely think about it. Then delusion persecuted, delusion hindered, they feel that their work is getting disturbed. They are not able to do. They are not able to go and attend the meeting. There are one patient was there. He used to get a lot of headaches, migraine headaches. He complained that, doctor, I am unable to attend the meetings. I have to literally cancel the meetings or leave the meeting and go home because of this migraine. And that is what is the hindered feel that they get. They feel a lot of pursued. कि डॉक्टर एक के बाद एक कुछ ना कुछ पीछा छोड़ता ही नहीं है. कुछ ना कुछ डिजीज आ जाता है. ये ठीक हुआ, दूसरा आ गया. ये ठीक हुआ, दूसरा आ गया. That is what is pursued. That something is coming up again and again to the patient, and patient is suffering from that. They feel delusion wrong suffered. We have many remedies today. I don't think we have that much time to differentiate all those, but delusion, they feel that they are suffering wrongly. It is not there in this case, but it is definitely seen in many cases of China. Discontented with everything, foppish, beautiful things awareness, heightened awareness of beautiful things. This is also another rubric which is nearer to foppish, which is seen in China. Also, China is gourmand. He is foodie. He loves to eat food. He loves to eat. He is a shocking type of person. That is what I said. He loves to eat. He loves to experience. In the China, there is a rubric, desires, full of desires. The lot of desires. And that is why they want to try all the food also. But at the same time, China is inconsolable. How much ever you try to explain them, if they are into that rubric of inconsolable, then it gets extremely difficult. Whatever you may do, they will not get consoled. It is only with when you introduce them, the dose of the medicine, then they will be consoled, and then they will be fine and understand the things. So also excessive weakness, irritability with the weakness, and dullness, coryza during. Now, what is this dullness, coryza? Coryza is such a small symptom, meaning, it is just a simple cold, a simple coryza. But simple coryza may be what happens to China. The China patient's activity goes down, he becomes dull and he becomes weak. Meaning, even with that smallest of the thing, that much is the thing which is affecting him. There is ailments from loss of vital fluids, desire, full of desires, anxiety, trifles. See, there are so many rubrics of anxiety. We will see those. Anxiety at smallest of the things, trifles. Anxiety driving from place to place because of the anxiety and because of fear driving from place to place. He just cannot sit at his home, or he cannot sit in the office. He has to get up. He has to go to doctor. He has to take some help and try to help his own self. Anxiety torturing. See, the way we see anxiety, delusion tormented, that similarly, anxiety is also of the level of which is torturing him. Anorexia nervosa and bulimia. These are also another thing which is very characteristic where the China is prescribed. Cheerful, alternating with sadness. China patients are otherwise very cheerful, but with smallest of the things they become sad. Delirium frightful, they get frightened very easily with smallest thing, whatever happens. I have described one case on delirium frightful in our NJH also of China earlier in some earlier issues. If those who are reading can see, those who have not can still subscribe the journal and NJH and can read those cases. That was also a wonderful case of China. Then there is a fear of impending diseases, delirium depletion after, delirium hemorrhage after, delirium from loss of fluids, and delirium from the pain. So all these things, loss of fluids, hemorrhages, or the hemorrhage is also again another loss of one of the vital fluid. With all this and with the pains, what happens is that patient goes into the delirium to that extent it is affecting him. So, friends, if we see, there are how many rubrics of fears and anxieties that I want to share with you. That we have seen lot of remedies like, stramonium, aconite, arsenic, which like whenever there is a fear, anxiety, panic, we think about these remedies, which comes very first in our mind. But along with that, if you are getting the other things like delusion, the fear of being injured, or the foppish, or delusion wrong suffered, or lot of desires, or government, then do think about China. That time, connect all the dots and see that, whether China is coming or not. Because I have seen that China also is coming up a lot with lot of fear and anxiety about the health. They do not have the fear and anxiety about other thing is less, but about the health it is more. And that is why when they get this, they will come to the doctors. They have the way we see that there is a fear and anxiety driving them from place to place. So they go from one doctor to another. So they are the patients, they would surely come to you. They will come with lot of files of the investigation reports, lot of files of lot of doctors. They would come and tell you that I visited this doctor, that doctor, and you will see that, okay, he is going out of his anxiety from here to there. So if you see what are the fear, these are, I have just extracted these rubrics of fear just to understand what is the fear of China. The fear of hearing bad news. As soon as you hear a bad news, this patient of mine, when he heard about his aunt, अरे मैं कल तो उनको मिला था and today she is passed away. But how much it affected him? Well, because she's an aunt, family member, it is going to affect you. Your friend who is CA, you do not expected him to pass away, it is going to affect you. But in China patient, it affects him a lot. He starts feeling that, okay, मुझे भी chest pain होने लगा, somewhere I am also going through that, I am also going to suffer, I am also going to get heart pain. Fear of death, fear of impending diseases, fear of impending diseases of which type? Which are contagious and epidemic diseases. Fear in our this COVID time also, the China has helped a lot of patients. And China was coming up in lot of cases because patients were having that fear of COVID, which was coming up at that time. Then fear driving from place to place. Fear of evil is something bad. Fear of failure, fear of falling, fear full of fear of being hurt emotionally, fear of imaginary things. They go into imaginations, they go into theorizing. China is also in theorizing. They go into that imaginations, into that theorizing, into their own mind, they start imagining and they get fearful and scared. Then fear of being injured. Then fear driving from place to place. Fear of misfortune, fear of suffocation at night, especially at night, fear of trifles. And see some of the anxiety symptoms also, like, anxiety in the morning on waking, anxiety alternating with irritability. Morning is the time when you are comparatively peaceful, you have just taken a good rest and you wake up in the morning. But the China patients, the anxiety starts in the morning itself, as soon as he wakes up. Anxiety driving him out of the bed. Anxiety beside oneself, from beside oneself. Anxiety driving from place to place. Anxiety with fear. Anxiety about future. Anxiety with suicidal disposition. How much is the anxiety? It makes him think to an extent of, going till the suicidal thoughts. Also, there is a rubric of death desires, into the China. One of my patient was so much tormented about his pains that, and his complaints, that he felt that डॉक्टर मुझे इतना कंटाला है, मैं इतना थक गया हूँ कि अभी तो मुझे मतलब मौत आ जाए तो इससे अच्छा है. I was like, huh? What are you talking? I mean, how much? It is not so much that these complaints are not so grave complaints that you think about directly at the going to the other extreme of death to that extent. So with anxiety also they start getting the suicidal thoughts. They start about thinking about the death, desiring the death. Then anxiety torturing and about trifles and unwaking. Yeah, friends. Thank you very much. Just a minute, I'll stop share. So, friends, this is what I wanted to share China with you all, because the way I said, in clinical practice, you can also think about the remedy like China, which we do think about in cases of hemorrhages, debility, or loss of vital fluids. But in cases of this anxiety and the fears, and especially about the health, which is related to health, and because it is related to health, the patients are going to come to us only. So that is the time we get a lot of this China patients visiting to us. But sometimes we should not miss them, and that was my this objective of presenting this case today. So yeah, thank you all. Nirupama, now whatever are the cases, questions, we can take up few questions and a few other questions. See, whatever today we will take it up, we will take up few of them. If we cannot take up the few others or all others, please, you all can ask your questions in the NJH Telegram group. I will surely reply to all the questions over there. Whatever I cannot answer over here.
So, conquetish is flirtatious.
Coquettish.
Also, was she coquettish and flirtatious? Was she flirtatious? Is a question.
See, now if you go to the coquettish meaning, the repertory, the dictionary meaning, then the coquettish has some sexual connotations in it. Like it is said that you get ready, or it is like the people get ready to attract the opposite sex or attract the other person, and that is how there is a sexual connotation which is attached to it. But when the patients, how will we see and apply it in the patients? As a homeopath, our role is what? That we should apply it in the patients, and we should be able to get the best of the results. So for that, in the clinic, when the patients are coming, how will they come? How will they present? So that is the time, most of the time, if you understand, if you think, then why do people get ready? The people get ready, some or the other reasons are there. Either you are going to some wedding, to some functions. I have a friend, he tells me कि वो शादी में भी जब भी जाते हैं ना, तभी the women, they get ready, so that बाकी के लोग, मतलब बाकी के उनके जो other colleagues है, जो other relatives है, they see them that they've got ready. उसके लिए जाते हैं, मतलब कि वो अट्रैक्ट करते हैं कहीं ना कहीं, वो भी अट्रैक्शन के लिए होता है कहीं ना कहीं, जब भी आप रेडी होते हो तभी वो शेड आता है.
What was the difference in ESR and other blood tests? CRP, uric acid, RA, X-ray.
Sorry, come back, Nirupama.
What was the difference in ESR, CRP, uric acid, RA?
Yes, friends, I'm really sorry because at this level, actually investigations करवा नहीं पाई मैं, and even patient did not do it. Then once or twice I had told them, but I'm really sorry. I'm little poor at that time. I cannot insist patients to get it done. तो वो हुआ नहीं है. एंड फ्रॉम माय साइड आल्सो पेशेंट वाज फीलिंग बेटर. तो मैंने भी थोड़ा सा वो इतना चाहिए उतना इम्पोर्टेंस मतलब अटेंशन नहीं देके नहीं करवाया इन दैट केस. सो आई एम
Explain
सॉरी.
diligent persecuted.
परसिक्यूटेड इज परेशानी. मतलब व्हेन यू फील कि ये मुझे तकलीफ कोई चीज से बहुत तकलीफ हो रही है, मैं बहुत परेशान हो रहा हूँ वो चीज से. दैट इज व्हाट इज परसिक्यूशन. व्हेन पेशेंट इज सेइंग दैट विथ माय पेन्स मुझे बहुत ही तकलीफ हो रही है, दिस पेन्स आर रियली गिविंग मी ट्रबल, इट इज गिविंग मी ट्रबल. दैट इज व्हाट व्हेन आइदर पेशेंट इज सेइंग or from the patient say and the patient's version, when we as a physician perceive that, then we can apply delusion persecuted.
Otherwise, there are remedies, nothing else.
Okay, so remedy, few differentiations we have done, like I have done. Few you can still do, but meaning agar if it is like whenever, like, when you are finally seeing the case in the totality and you see that everything is when you are able to connect all the rubrics whatever you are getting in the patient. Because see, when I saw that torment in the second case, इन द केस ऑफ चाइना, और उसके साथ में जब भी मुझे वो पॉपिश और गुरमन मिल गया ना, तो फिर मेरा मतलब वो हो गया था कि अभी चाइना ही है. देन मीनिंग आई वाज नॉट इन ऑन टू द आर्सेनिक और एकोनाइट और एनी अदर रेमेडी. मतलब वो मेरा वहीं पे रूल आउट हो गया फिर.
The remedies here in group had come China Ars Veratrum album.
विराट्रम एल्बम. ओके, विराट्रम एल्बम क्यों आया? कहाँ से आया होगा? एनी आइडिया? निरुपमा कुछ दिया है? विराट्रम एल्बम, बिकॉज सी विराट्रम
Not
एल्बम.
given anything. I think, but you have explained remedy very well. China,
हाँ,
you have
और
explained
विराट्रम
very
आल्ब
well.
तो कैसा है कि विराट्रम आल्ब इज अ वेरी बोस्टर है. ही इज इनटू दैट सेंस ऑफ हिज वेल्थ. बोस्टर है यहाँ पे सब. सी व्हेन द पर्सन इज ड्रेसिंग अप आल्सो, इट वाज नॉट वेल्थ दिखा नहीं रहा था वो, या पेशेंट के इसमें भी कहीं वो वेल्थ, शायद उनको वो सीए है या वो उस पे से अगर वेल्थ लगा होगा तो उसके ड्रेसिंग पे से वगैरह. I'm not sure. I don't know where the Viratrem alb enters also here. Sorry, I can't, it doesn't enter in my mind. And Viratrem alb is into the moral feelings want of, the patients. No, यहाँ पे नहीं आ रहा. Yes, Nirupama.
Yeah, that's all.
Still, if anything else is there, friends, we are open. You please connect us at NJH Telegram group, and please put your questions. Those of you who are not yet into the NJH Telegram group, NJH Telegram group is a group where we provide to you all the informations about all the seminars, webinars, and all roundtables which we have every fortnightly. Every fortnightly, we have one webinar and one roundtable by the NJH team. They are working selflessly just for the homeopathy. And so you can get all the information from there. Some of you, if you are not there, please try to connect any of us. We will share you we will add you over there. We have not kept it open because there are some hawks who are troubling us in that. That is why, but we will add you into that. You just connect with any of us, any of the NJH EB members, and we will share it. You can tell it to anybody. Thank you very much. Thank you very much. I would be really grateful to the complete team of NJH. I'm thankful to Dr. Vishpala ma'am, complete team of NJH, Dr. Asrani sir, Dr. Bhaskar sir, Dr. Ajit Kulkarni sir, and Dr. Praveen sir. Under their able guidance, we are able to work a lot under the NJH platform. NJH is doing a lot of other activities, so friends do connect with all of these academic activities. All my other colleagues and the NJH EB team, I'm very thankful to them and very happy, to learning and sharing with all of you. Thank you so much, friends. Thank you very much.
Thank you, Shobha, for wonderful session.
Thank you, Nirupama. Thank you very much, Nirupama. Thank you very much.
Yeah. Thank you, friends.
Nirupama.
Yes.
There is one doctor who is asking, I think, about the whom to ask for joining the Telegram group or any link. You can just share. Can you share Munira's or my number, contact number?
On laptop, I don't know how to share, but from wherever
Okay.
you received
Okay.
link on that group, you ask for the number, we will provide you
Yeah. Wherever you got the link also. Yes, that is
today's link
wonderful.
from
Yes, we
wherever you
can.
got.
I can share Nirupamare, this Munira's number over here. Just a minute. Just in 1 second, I will share Munira's one number at least. Munira is our NJH manager. You can contact her for any queries related to NJH. If you want to subscribe NJH, please contact Munira. Yeah, Dr. Rachna, I think you can save this number. Dr. Rachna is asking about this, or any other doctors also who are asking. Also, please share your cases. Yes, Dr. Kanoja is saying, please share your cases for the NJH publications. NJH is a platform which is giving you to share your cases. You can share your successful cases, and others can learn from your cases. You can share your learning. So friends, do share and grow through
And
sharing.
August issue is based on mental rubrics.
Yes,
So
mental
next,
rubrics part 2. We
yes.
have got many cases of mental rubrics, and that is why we are coming up with the second issue of mental rubrics. So the first rubric is issue is just on its conclusion. But so if anybody wants to share any cases on mental rubrics, do share. Okay. Nirupama Chalo. Thank you very much.
Thank you.
Thank you
Thank you,
so much.
friends.
Thank you, Nirupama, for moderating this session wonderfully. Thank you so much.
Thank you.
Yeah.